So this is a flow chart which is mentioned in the journal. If you look for this journal, it is free accessible journal. You can download the PDF. I've taken this flow chart from the journal. And what is the normal starting dose? We will talk later about the types of insulin. First, we talk in general terms about the uh, broad doses. How should we start? What should be the dose of starting for insulin therapy? So, in general, starting dose should be anything around, if we talk in terms of units, then it should be around 10 units for, I'm talking about adult patients, or it should be around zero point 0.1 to zero point 0.2 units per kg body weight per day. So, somebody who is, is 50 kg body weight or 100 kg body weight or 75 kg body weight, you can roughly calculate the you can roughly calculate the बहुत sure हो रहा है. You can roughly calculate the insulin requirements. So 0.1 kg body per kg body weight for 50 kg would be around 5 units. 0.2 unit per kg body weight for 50 units would be around 10 units. So between 5 to 10 units it can start, and in general, as I said, practically it would be around 10 units per day for an average adult person. Uh, and then if there is episode of hypoglycemia, then you have to accordingly readjust. And if you are not able to achieve your target sugar goals, then again uh, you have to uh, adjust the insulin doses. So there is calculation, how do you increase your insulin doses and how do you reduce your insulin doses. So suppose you start with 10 units of insulin and your goal is not achieved, because you have to counsel the patient about self glucose monitoring, and then you have to be in touch with the patient, and then until that level where we have set the goal as per the guidelines that is achieved, then we have to keep on adjusting. So normally, uh, you know what is recommended, that you should adjust the dose if you have to increase something around 2 times in a week. Normally, practically it can also be increased on day-to-day basis, but normally it is recommended that you adjust the insulin doses in 2 times in a week, and you can increase the dose of insulin by 2 to 4 units per day. So gradually you will increase the dose so that you are able to meet the optimal fasting sugar levels. And similarly, if there is episode of hypoglycemia, then you have to reduce the dose, and again, it should be 4 units reduction is recommended, which is around 10 to 20% of total insulin requirement. So what we learned till now, to start insulin, it should be zero point 0.1 to 2 units per kg body weight. For a 50 kg adult person, it would be around 5 to 10 units. Practically, we take it 10 units. And if you have not achieved the sugar levels, or the goals of objective sugar level goals, then you have to increase by the units of 2 to 4 if you have not achieved it. And if there is episode of hypoglycemia, then you have to reduce the insulin levels by 4 units. So this is the recommendations we should be remembering for practical units. So, and then for practical purpose, we will be discussing this later also. But it is important that we know that insulins are of 3 4 types. So there are rapid acting, intermediate acting, long acting, and ultra long acting. And the purpose of is that achieving a basal sugar level in body within range, normally below 200. Uh, so, and then if you go through this, table or chart, then you learn insulin doses. There are mixed insulin also, where you have, like, you would all have heard about mixed start 30/70. So, where 30% is rapid acting and 70% is intermediate acting. So then there's a mix of insulins, and other types of insulins are mixed if you're not able to achieve. And this is how it has been explained in this chart. And you can find this chart in this particular article of American Family Physician. So we'll move forward. These are the basic things, practical things, because insulin and diabetes management is a very big clinical domain, and all that cannot be covered. I'm just picking up the practical points, and we can also later discuss how we practically, apply those guidelines in our practice. But broad things we have to keep in our mind when we think of insulin management and when we deal with patients who are on insulin. We should be knowing about those insulin. And this, as I said, there are different guidelines. There's American Academy of Clinical Endocrinologists and American endocrinology departments, and their recommendations are like this. HbA1c, if it is below 8, then what is the daily dose, and if it is above 8, then what should be the daily dose. So if you look at this particular table, there are terms which are augmentation therapy and replacement therapy. What is augmentation therapy? When you are augmenting or adding on the oral hypoglycemic ongoing, you are just replacing some additional requirement of insulin. Whereas in the replacement therapy, it is, there is no, there's hardly any insulin production in the body itself, and you are largely replacing. In that condition, oral hypoglycemic agents are not working at all, and you have to be replacing the total insulin requirement. So these are the guidelines of American Association of Clinical Endocrinologists and American College of Endocrinology, and is recommendation on augmentation as well as on replacement therapy.